Did you know that 80% of men diagnosed with prostate cancer survive when they catch it early? That's right. Early detection is not only important, it's life-changing. For many men over 65, ignoring what's going on down there has become second nature. That stops today. Your prostate, a walnut-sized gland located below the bladder, has been quietly doing its job for decades. It produces the fluid that protects your sperm, making up nearly a third of your semen. Most men never think about it until something goes wrong. As you age, this gland naturally grows larger. This is a normal change that happens to all men. But sometimes, this growth is not benign. It's cancer. 1 in 8 men will be diagnosed with prostate cancer in their lifetime. Those odds are too high to ignore. What's the most dangerous aspect of prostate cancer? Early stages often have no symptoms at all. No pain, no discomfort, nothing to make you call the doctor. By the time obvious symptoms appear, precious time has passed. Knowledge is your most powerful weapon against prostate cancer. Today, we're pulling back the curtain on 6 warning signs your body may be sending you. These signals can be easy to dismiss as just getting older, but recognizing them can mean the difference between a simple treatment and an uphill battle. If you value your health and independence, please like and subscribe. Because knowledge is not only power, it's more time for the people you love. Sign 1. Urinary problems. Nighttime bathroom trips have become so common among older men that we joke about them at family gatherings. But these changes in urinary habits might be your body's first warning that something is wrong with your prostate. When a tumor develops in the prostate, it puts pressure on your urethra, the tube carrying urine out of your body. This pressure creates several noticeable problems: a weak urine stream, difficulty starting urination, stopping and starting multiple times during urination, and never feeling like your bladder is completely empty. Most men immediately assume these symptoms just come with age. Sometimes they're right. Benign prostatic hyperplasia, BPH, causes similar symptoms. The critical difference: cancer-related urinary changes often develop more rapidly and worsen steadily, while BPH symptoms typically progress slowly over many years. Research confirms that 85% of men with early-stage prostate cancer experience urinary disruption. This isn't coincidence. It's your body sending an urgent message that something isn't right. Waking up multiple times each night to urinate deserves your attention. If you're making 3 or more trips to the bathroom nightly, your body is trying to tell you something important. Don't silence this warning by simply accepting it as inevitable. These bathroom habits aren't appropriate topics for dinner conversation, but they're absolutely appropriate, even essential to discuss with your doctor. Ignoring these changes doesn't make you stoic or tough. It puts you at unnecessary risk when early intervention could make all the difference. Sign 2. Pain during urination. Pain or burning during urination is never normal. Never. When you experience discomfort while urinating, your body is sending an unmistakable distress signal that demands attention. When prostate cancer develops, it often causes inflammation in the urethra. As urine passes through this inflamed area, you feel burning or sharp pain. This isn't just uncomfortable, it's informative. Your body is communicating something vital about your health. The persistence of this pain separates it from other causes. Urinary tract infections typically clear up with antibiotics within days. Cancer-related pain, however, continues or keeps returning despite treatment for other conditions. Research published in the Journal of Urology reveals a startling fact. Men experiencing painful urination combined with increased nighttime urination face a 40% higher risk of prostate cancer. This combination of symptoms isn't just inconvenient, it's potentially life-threatening. Certain substances make this discomfort worse. Caffeine, alcohol, and spicy foods intensify the burning sensation by irritating an already inflamed urinary tract. Many men mistakenly believe these substances are causing the problem rather than simply aggravating an existing condition. Pain serves a purpose. It's your body's alarm system. When this particular alarm sounds, responding promptly with proper medical evaluation could save your life. dismissing this pain as just another sign of aging isn't just incorrect, it's dangerous. Sign-kolm, blod in urine. Blood in your urine is one of the most alarming symptoms you can experience. Whether it appears as visibly pink, red, or brown-colored urine, or is only detectable through laboratory testing, blood in urine always requires immediate medical attention. When prostate cancer grows aggressively, it can break through small blood vessels in the urinary tract. Even a tiny amount of blood can dramatically change the color of your urine. This visible change represents a significant warning that something serious is happening inside your body. Blood in urine ranks among the most serious symptoms on our list. While kidney stones or infections can also cause this symptom, blood in urine always warrants prompt medical evaluation. This isn't a wait-and-see situation. It's a see-the-doctor-now situation. Harvard Medical School research confirms that approximately 35% of patients who present with blood in their urine receive a prostate cancer diagnosis within 1 year. This statistic alone should convince you of the importance of this symptom. The intermittent nature of bloody urine often leads men to ignore it. You might see blood one day and normal urine the next. This inconsistency can create false reassurance. Don't be fooled. Even a single episode of blood in your urine requires professional evaluation. Your urine color is one of the most basic indicators of your health. When it changes significantly, especially to pink or red, your body is sending an urgent message that something is wrong. Responding promptly to this message could make the difference between early, effective treatment and a more challenging battle later. And SEMEN, blod in semen. Blood in semen, appearing as pink, red, or brownish discoloration, is perhaps the least discussed but most distinctive warning sign of potential prostate problems. This symptom often causes significant anxiety when first noticed. When cancer develops in the prostate, it can invade the seminal vesicles or ejaculatory ducts that contribute fluid to semen. As the tumor damages small blood vessels in these structures, blood mixes with seminal fluid, creating visible discoloration. This symptom is particularly valuable from a diagnostic perspective because it can appear when the tumor is still relatively small and highly treatable. Unfortunately, embarrassment prevents many men from reporting this symptom promptly. European urology research reveals that approximately 90% of men who notice blood in their semen don't immediately seek medical advice. This hesitation leads to delayed diagnosis and potentially more complex treatment. Blood in semen can sometimes be confused with other discolorations caused by diet, medications, or infections. However, true blood in semen appears as a distinct pink or red tinge and may contain visible blood streaks. This isn't a subtle change, it's obvious and concerning. While prostatitis, inflammation of the prostate, can also cause this symptom, persistent or recurrent episodes should never be ignored. Early detection through proper evaluation significantly improves treatment outcomes. Overcoming embarrassment to discuss this symptom with your doctor could literally save your life. Sign 5. Erectile dysfunction. Erectile dysfunction affects millions of men, particularly after age 65. While occasional difficulties are common, when erectile problems develop suddenly or steadily worsen without explanation, they might signal prostate cancer. Prostate cancer affects erections through several mechanisms. The tumor can directly invade the nerves and blood vessels controlling erections. As cancer progresses, it can also disrupt hormone levels essential for sexual function. What distinguishes cancer-related erectile dysfunction from other causes is its progression and response to treatment. ED caused by prostate cancer typically develops gradually but steadily worsens over time. It also tends to respond poorly to standard ED medications. Johns Hopkins University research indicates that newly developed erectile dysfunction in men over 60 is associated with a 25% increased risk of prostate cancer. This connection makes erectile problems an important symptom, requiring medical evaluation rather than just acceptance. The psychological impact of erectile dysfunction is profound, affecting relationships and self-esteem. Many men avoid discussing this symptom with doctors due to embarrassment. This hesitation can delay crucial diagnosis and treatment of underlying prostate cancer. How sexual function remains important throughout life. Changes in this function aren't just about intimacy. They can provide critical information about your overall health. Addressing these changes promptly with medical professionals isn't just about improving your sex life. It could be about saving your life. Sign 6. Bone, pelvic, and upper thigh pain. Persistent pain in your lower back, pelvis, or upper thighs might be more than just normal aging or overexertion. When prostate cancer spreads beyond the prostate gland, it frequently targets nearby bones first. When cancer cells invade bone tissue, they cause a distinctive type of pain. Unlike muscle strains or arthritis, cancer-related bone pain tends to be constant, gradually worsening over time, and often intensifies at night. It typically doesn't improve with rest or position changes. This pain has specific characteristics that set it apart from ordinary aches. It's persistent, doesn't respond well to over-the-counter pain relievers, and often disrupt sleep. If you're experiencing pain with these qualities, particularly in your lower back, hips, or upper thighs, it requires medical evaluation. The New England Journal of Medicine reports that approximately 70% of patients with advanced prostate cancer experience bone pain. This high percentage makes bone pain a critically important symptom to recognize, especially in men over 65. The presence of bone pain often indicates later-stage disease. When prostate cancer remains confined to the prostate gland, the 5-year survival rate exceeds 95%. However, once cancer spreads to bones, this rate decreases significantly. Early detection of bone metastases dramatically impacts treatment options and outcomes. Pain serves a purpose. It demands attention. When pain persists in these specific areas without clear cause, your body is communicating important information about your health. Responding to this communication promptly could significantly impact your treatment options and quality of life. The 6 warning signs we've covered: urinary problems, pain during urination, blood in urine, blood in semen, erectile dysfunction, and bone or pelvic pain, aren't just symptoms. They're potentially life-saving messages from your body. Prostate cancer is highly treatable when caught early. The 5-year survival rate for early-stage prostate cancer exceeds 98%. This remarkable statistic underscores why recognizing these warning signs promptly is so crucial. Men over 50 or those over 45 with risk factors like family history or African American heritage should discuss prostate cancer screening with their doctor. The standard screening includes a simple blood test called PSA, prostate-specific antigen, and sometimes a digital rectal examination. Beyond screening, lifestyle choices significantly impact prostate health. A diet rich in fruits and vegetables, regular exercise, and maintaining healthy weight all contribute to prostate health. Limiting red meat and high-fat dairy while increasing fish, tomatoes, and green tea consumption offers additional protection. The most important takeaway is this: paying attention to your body's warning signs isn't being anxious or hypochondriacal, it's being smart. These symptoms aren't just inconveniences to be endured as part of aging. They're valuable information that could save your life. Share this information with other men in your life. Fathers, brothers, sons, friends. Knowledge is power, and in this case, it could be life-saving. If you found this information valuable, like this video and subscribe for more important health information. Next week, we'll share the top 5 foods that help protect prostate health. Subscribe now so you don't miss this important information. Remember, your health remains your most valuable asset at every age. Protecting it isn't just about living longer, it's about living better.